Good evening, everyone. Thank you for joining us on this cold, blustery, and winter evening. Welcome to the Taping and Movement series by Elastoplast. This is the 5th episode in our series. And tonight we're going to be talking about core exercises you can do at home, particularly how to help your posture. My name's Paul Hermann. I'm an osteopath and an exercise and sports scientist at Stay Tuned Sports Medicine in Melbourne. And one of the reasons I'm teaching this tonight is I'm the national presenter for Elastoplast, but also because I want to see that patients and people can do some stuff at home to help them throughout this isolation period. We're all stuck at home, whether you're in Australia and most likely around the world. So the more we can do to help ourselves, the better off we'll be. And that's what this whole series is about. We've had 4 fantastic episodes so far, and hopefully you enjoyed tonight's episode as well on the home exercises for the core and how they relate to the posture. A little bit of housekeeping. If you have questions for me, that's fine. Please put them onto the chat. And thanks to the brilliant guys from Elastoplast in the back end, Lockie and Jared, they'll sort through the questions and shoot some of them through to me. I will get through as many questions as I possibly can tonight, but we are limited a little bit on time, so I apologize in advance if I don't get to your specific question. If that's the case and I don't get to your question, feel free to shoot through a direct message via the social media platforms or via the links that you have to Elastoplast. They'll forward them to me and we'll see what we can do about getting you some answers over the coming weeks. On that note, if you'd like to follow us on social media, you can follow Elastoplast ANZ on Instagram or myself, paul.osteo.staytuned. Feel free to do some screenshots, tag Elastoplast in them, tag myself, and we'll be sure to share those and share the love. So thank you so much for that. Now, getting started, tonight is about core. Core is one of those things that gets bantered around a lot. We talk about inner cores, outer cores, local systems, global systems, deep stabilizers. It's been around a little while and it came into a lot of the discussions in physios and osteo worlds probably 15 years ago, maybe even 20 years ago now. And there are some confusions about what is the core and what isn't the core. To be honest, what I'm going to talk to you tonight about is how to strengthen your trunk. We'll talk about some inner core and outer core exercises, or we could interchange those phrases with deep and superficial, or we could interchange them with local and global. They're all pretty much saying the same thing. When we talk about deep, or we talk about local, or we talk about the inner core, we're really talking about the stability system, the ability of small movements, small contractions to maintain our joints, particularly in our spine, and maintain the control of them so that they don't get too much translation, neutral zone, or slippage. Essentially, to get the small muscles to help stabilize us in a local system. Then when we talk about outer core, or we talk about the global system, we're talking more around general postural trunk exercises. So I'll be referring to things all the way from our neck through to our pelvis and into our glutes. And those global systems will be more around the muscles of our abdominal region, our upper back, our general bigger muscles, and the local or the deeper systems, the inner core systems, we'll be talking more around the small muscles around the spine. So I just wanted to clarify that. First of all, there's 2 exercises I want to take you through. These are strength exercises, which would be trunk-based exercises to help improve your posture at home. The one thing we're seeing in our clinics, and I'm sure everybody who's working from home is experiencing, is a bit of postural fatigue. In fact, I think by this stage of isolation, we're all experiencing a lot of general fatigue, emotional fatigue, mental fatigue, and postural fatigue. And that results in us tending to be a little bit slouched. If you were in my session 2 weeks ago, you would have seen a lot of information or heard a lot of information around how to improve our posture, how to keep ourselves mobile, and how to reduce the risk of postural-based issues. So if you weren't there 2 weeks ago, you can jump on again to Elastoplast's website or onto their social medias, and all the episodes are downloadable through Instagram particularly. But we were talking a lot about how when we do get fatigued, we tend to slouch in our posture. We tend to sort of drop our posture. And this can lead to a forward head carriage, it can lead to pressure in the neck, and it's possible that it causes pain and other problems in the body. So these first 2 exercises I want to teach you are around opposing that posture, that slouch, and strengthening the muscles to improve their ability to keep us upright throughout the day. The first one, and by the way, I'd love you to join in on these exercises. I can't see you, but I'm sure you're all going to do this at home. The first one is called Brugger's postural break. Now, Brugger was a Norwegian neurologist who came up with this. It's a fabulous exercise. We went through it briefly last time, but I really wanted to go through it in a little bit more detail because it is a general total core or trunk exercise. And how we do this is we place our hands by our side and we pull our fingers apart from each other. So we spread our fingers as far as we can. Then we rotate our arms out as if we're trying to get our palms to face the walls on the outside. Turn a little bit so you can see. So we take our palms and we turn them out and we pull those fingers away from each other. We then lift our sternum or our chest bone here and we bring our shoulders back and down. Then what we do is we squeeze our shoulder blades together while we're still pulling those fingers apart, still turning those hands out, and we take the deepest breath in you can possibly take. So we really want to expand the diaphragm. We really want to expand the upper and anterior or front rib cage as deep as we can. And then we breathe all the air out, letting it go out, but without changing our posture. And then we even squeeze our abs to get that last bit of air out. So follow me with me here for 3 breaths. We're going to go in really deep, pulling those fingers apart, letting the air go out, and then squeezing that last bit of air out. I generally suggest doing this for 3 to 5 breaths. Some of the papers and some of the studies you'll see will suggest doing it more often, for longer or more breaths. Personally, I get a little bit dizzy if I do it too much. So stick to the 3 to 5 breaths, and certainly if you do get dizzy, stop there, have a rest, and that's your limit. That's your sort of number of breaths for you. The second exercise we're going to do is called, it's one of my favorites, it's called the Clockface. And to do so, I've taken a bit of Elastoplast resistance band here. This one's a yellow, so it's a reasonably light band because I'm not very strong. What we're going to do is we're going to hold this a little bit wider than shoulder width. So hopefully you can see there, I'm just a bit wider than shoulder width. I'm giving a good grip so it doesn't slip. And I'm then going to pull my hands apart until the band touches my mid-chest. I'll show you some side on here. So I'm pulling apart with straight arms until the band touches my mid-chest, and I'm squeezing those shoulder blades back together. Now it's called Clockface because when I'm doing this, I'm at 3 and 9. Now I'm going to go at 2 and 8, 1 and 7, and back to 2 and 8, 1 and 7, 3 and 9, and then we're going to go 4 and 10. This tests my ability to know the clock, and then we're going to go 5 and 11. We never go 6 and 12. We don't go straight up and down. And the whole time, as you hopefully can see, that band is still touching through the mid-chest. So I'm not pulling it off to the side here. And I'm not pulling it off to the side there. It's still coming right across my mid-chest. One of the reasons I love this exercise, and by the way, we do this a few times around the clock. So you might do 3, 4, even 5 repetitions at each clock position. One of the reasons I love it is, as you can see, I'm still at my desk. I can do this sitting. I can do this as a 30-second break. I encouraged everyone 2 weeks ago in our workshop to do a 60-60 challenge, which means every 60 minutes, you do 60 seconds of something else, something other than typing away on your laptop or your desktop. So this could be one of those things you do every hour, a bit of a clock face workout, a Brugger's break, and then the next hour, you might do some of our other exercises that we did 2 weeks ago, or some of the ones we're going to do today. So moving on, we've got a few more core exercises. This is where I'm going to bring in the fabulous Loz. Loz is one of our staff members. She's an admin team member of ours. Loz is also a nutritionist and currently finishing her master's in dietetics. So Loz has been very kind to come and offer her help here. We're going to start by doing a foam roller exercise. Thanks again, Loz. So we're going to get Loz laying down here with her head on this end and her bottom on the other end of the foam roller. Now this is our long or 90 centimetre foam roller. And you can see the foam roller here is fully supporting Loz. So it's all the way along her spine. She's got her sacrum or her bottom on the foam roller, and she's also got her head nicely supported. Her knees are bent to about 90 degrees there. And this is an exercise to work at some of those deep or inner core muscles. So it works a little bit of our balance and proprioception as well. So I'm going to ask Loz to turn her hands down and just rest her fingertips on the ground. Now, you might not be able to see an image, but she's got her arms down around 45 degrees out, and fingertips are on the ground. So we've got some feedback from our fingers here to help us with balance. And the exercise is an alternate leg lift. So from here, we're going to get Loz to lift one leg up to about a tabletop position. Fantastic. Back down, and then lifting the other leg up. And this is level 1. So this is an exercise that will start to challenge those deeper muscles, because you're going to have to react on top of the foam roller. We can make it a little bit harder by reducing the amount of pressure we put on our fingertips, or by bringing our hands in by our sides. So now we've got Loz with her arms by her side, so our base of support is a bit narrow, and we'll go with those legs again, please, Loz. Lifting up, alternate legs. So now our base of support is narrower. It's a little bit harder to react. When we're doing this, Loz has been practicing this a lot, so you probably can't see, but there's only very tiny reactions. She's getting some very small, what are called perturbations, or muscle reactions to this imbalanced or difficult exercise. Now, as we get better and better at this, those reactions become less. So we need to continually increase the challenge. To do so, Loz doesn't know we can do this, we would, cross your arms across your chest. Now that does make it very challenging, and we'll start to see some more reactions. And if you're anything like me, I fall off usually about at this point. And look, that's okay, as long as there's nothing sharp or dangerous nearby, don't worry. It's all about progression, not about perfection. So make sure that whatever level you're at, that it's challenging but achievable. There's no point if it's super, super easy. But there's also no point if you simply can't do the exercise, if you can't maintain your balance on the foam roller. So we want to be challenging but achievable. Okay, so that's our 3 levels of the foam roller alternate leg lifts. We'll pop you up again, Loz, if it's all right. Then we're going to go to our Swiss ball exercise. So we'll grab that ball there. Let's get you up against the column, just facing the camera there. So this one, I'll hop in next to you here. This one is an alternate leg extension on the Swiss ball. Again, it's more of a reactive, deeper or inner core exercise to help us react to the movements of the ball. We're using an unstable platform here, being the ball, similar to the foam roller, but we're in a seated position, which is more akin to what we do when we're sitting at the desk. So then we're going to ask Loz, with her feet starting together, knees together, to straighten out one leg at a time. And we're looking to see that those knees stay at the same height. Again, we're hoping to see some little reactions and some movements that keep Loz on top of the ball. Again, we don't want it to be so hard that she falls off, but we don't want to be so easy that, like sitting on a chair like me, that there's no reaction. The slower we do it, the harder it is, because the more time you have to stabilize or react to get control on one limb. The other way we can make it a little bit harder is we could ask Loz to close her eyes. Now, by doing this, we remove some of the feedback mechanisms we get from our visual system. So it creates more challenge to stay balanced and therefore more reactions. Okay, you can open your eyes again, Loz. Thanks, well done on that one. So it is quite a challenging one, that one. The reason we want those reactions, so there's absolutely very little point in doing these exercises if there's no reaction. The reaction causes the contraction. The small contractions that keep us in control is what improves our core control. People call it core stability, intersegmental stability, spinal stability. We're all kind of talking about similar things. And then for the purpose of this conversation, we want those little reactions to get our trunk or core control. Okay, so we've got eyes open, eyes closed. You can also play around with leg positions, have them a little bit wider or have them together. Again, you can cross your arms. I've even had patients before doing this while throwing a ball from hand to hand, so that their mental focus is on something else while they're having to react and stabilize through their core. Okay, now we get on to some slightly tougher exercises. We're going to move into our planks. Everybody loves a good plank. We'll pop that one back. So if I can get you, we'll go face up this end, please, Loz. So we're going to start with what's called a high plank on our knees. This is, otherwise we refer to this as an all fours position. So this is challenging Loz's core or her trunk muscles here, because she's got a nice straight line from her knee, as you can see here, to her shoulder. Her hands are directly underneath her shoulders and they're about shoulder width apart. And what I love seeing with Loz doing this is her eyes are straight down at a slight angle in front, so that her neck stays in line with her mid and lower back. We don't want to, Loz, if I can get you to look at the wall in front, we don't want to see this neck kink. I'll just move your hair a little bit. We don't want to see this neck kink here. By the same token, if I get you to tuck your head all the way down, we don't want to see that head dropping. So we want to see a nice straight line all the way through the spine through the neck, so we've got that slight angle forward. So this is our high plank on knees. Then we get to a progression where we go to a low plank on knees. So we're going to go down onto our elbows or forearms. We're still on our knees here, and we've still got this nice straight line going through the knees and to the shoulder. And again, Loz has demonstrated this really well with her eyes looking down, so that neck is in a nice neutral position. Same rule applies. We don't want to see the neck kinking up, looking straight ahead, and we don't want to see it flexing or tucking under. Now, over a period of time, you can probably have a bit of a rest there if you like, Loz, while we talk. We don't want to see the spine sag. So if the spine drops down into the ground, you'll see this big curve in the back. That's going to compress the joints. It's going to make your back pretty sore pretty quickly. The cheap mechanism for this, I call it that because we all need to do it at times, is to actually lift our bottom up. So can I get you back into that level 2 again, please, Loz? So forearms and knees. And if you could lift your hips up towards the roof. So this is a slight cheat or rest position. I prefer the word rest than cheat. This takes the pressure off our total trunk and core muscles a little bit and can give us a mini break. You can have a rest again there. So lifting the bottom up can be a bit of a cheat, but it can also be used as a rest. As long as you don't stay in that position and you get back into that straight line from knees to shoulders, then we're really challenging all the muscles evenly around the trunk. When we flex up, we're using a little bit more of some muscles more than others. We want to keep that spread nice and even. Okay, going on to our next level. This is where it starts to get a little more challenging. So this is a full high plank. So this is going to be on our straight arms, but on our toes. Same rule applies here, except now the straight line is from the ankle to the shoulder. Loz demonstrated this really well. She's got a really nice straight line through there. And Loz, we'll get you going to that rest position. So lifting the hips up a little. Yep, so this is kind of like a rest or cheat position. That's okay for a short period, and then we drop down into the neutral position again. But we don't want to go any lower than that. The other way to have a rest is to bend your knees and to just drop down onto your knees again, so you can get a little bit of a rest when you need. I think the world record, while you have a rest there, Loz, I did look this up recently. It was something ridiculous. It's a long, like 60 hours, I don't know, 16 hours maybe, but it's ridiculous. It's a long period of time. Let's not go for that. Let's just do the 60-60 challenge, hey? So every 60 minutes, try and do some form of plank for 60 seconds. If we can do that, and if you did that every hour of the day, tell you what, that's a pretty good day of a lot of planking. And mix it up with your different levels. Okay, now we're going to go to our full low plank. So we'll go toes again, but instead of being on our hands, we're down onto the forearms. Again, really nice straight line all the way here from the ankle through the hips and to the shoulder. We've got this really nice straight line. Loz has got her knees straight, but not locked out, so they're not aggressively compressed. They're just nice and straight, and we're not sagging through the abs, and we're not lifting up through the hips. You can have a rest there, Loz. It's a hard work doing all the demonstrations and planks. Okay, so these are our front planks. These challenge our front muscles and a little bit of our obliques or side muscles, but they're mostly working the front muscles of the trunk or the core. We also need to work our side muscles and the muscles between our pelvis and our hip. So we want to work this whole lateral or side plank region here, sorry, side trunk region here, so that we're getting complete work around the whole core. To do so, we're going to do what's called a side plank. So can we get you onto your side, please, Loz? We'll start with the bent knee side plank. So this is a level 1. We're on our forearm. Fist or arm is forward. The elbow is directly underneath the shoulder there, as you can see. And this is in a side plank position where the knees are going to go back slightly. I'll just move that out of the way. Fantastic. And then from there, we're going to lift our hips slightly and bring the pelvis slightly forward. The reason we want this pelvis forward is now there's a straight line from knees to shoulders here. And you can see Loz has already adjusted her head position. So again, that neck is in a nice neutral position. If you were to take your right ear down, Loz, yes, that's when the neck gets a bit tired. We're going to sag there. We're going to get a bit of compression in the neck. Or if we lift it up too high to try and keep our eyes level to the horizon, we're going to get compression on the left-hand side of the neck. Okay, so this is our side plank level 1. We can do the next level by bringing the top leg straight. So we're at kind of level 1.5 here. And the next level again is with both legs straight. And this is a big challenge. Well done, like an absolute champion. This is a full side plank. Now from here, we can go into what's called up-down. So we can actually take our hips up and down to work through repetitions. You can have a rest there if you like, Loz. The reason sometimes we go for repetitions rather than time is, one, it's a bit of variety. It gets pretty boring after a while, just being stuck into a side plank or a front plank. So to get some variations, we can go up and down. We can change from level 1, level 2, level 3. Although they're increasing in difficulty, it's okay to mix it up because you are going to challenge the muscles in a slightly different way. So you can mix it up with repetitions going into up downs as well. Now, the next one is going to be a bit of a challenge for Loz. We're going to go into, this is an advanced, more advanced version. So this is a rotation. So we're going to go in from a front plank to a side plank. Now, Loz will only be able to do this one way, lucky for her. So we're going to get her to rotate onto the side plank and then back to a front plank. And then, oh, you reckon you can give it a shot? Yeah, look at that. Fantastic. So we're going from front plank to side plank. This creates motion while we're having to control or stabilize our trunk or core. So we're having to move it and control it at the same time. So it's definitely a more advanced version of that. Okay, now one of the things I get asked all the time as an osteopath is, I love ab crunches, I love sit-ups. Are they good or are they bad? There's no exercise particularly that we should categorize as good or bad. But when we spend a lot of the day, I'll sit on the ball here so you can see me side on, if we spend a lot of the day sitting in a rounded position, the muscles at the front of our trunk here tend to get a bit short. They get a bit tight and they get a little bit short. So it seems like when we've got these short muscles, why would we go and then strengthen them up in that shortened position? So sometimes with patients, especially to avoid pressure on the neck, I get them to do reverse curls rather than replace their sit-ups or their crunches with reverse curls. Now, I'm not saying sit-ups and crunches are a bad exercise. This is just an alternative to mix it up a little bit and to take pressure off the neck. So if we can get you laying on your back, please there, Loz. A reverse curl, as you can see in this position, Loz is going to lift her legs up and down, just tapping the feet on the ground. And this is working the abs from a lower lever point of view. What I hope you can see there is that Loz's neck is completely relaxed. The head's on the ground. She's chilling out. She's probably thinking of I was going to say next holiday, but I hope not because we can't take them anytime soon. But she's dreaming of a nice, happy place and her neck muscles aren't being stressed during this. Okay, we're not having to shorten them up and stress them out. And we can do this with 2 legs, or we could go 1 leg at a time. So we can alternate the leg depending on the level of strength you have. The important thing here is if you are doing this, make sure your back maintains its current position. People talk about neutral spine and whether we should be flat or whether we should be curved. The key here is whatever your neutral is, whatever the normal position for your back is. So when you lay down and you get comfortable, that position of your back is where it wants to be maintained. So keep it there. Don't let it flatten out against the ground and don't let it arch up. Try and maintain the position. The general rule, of course, with all these things is if it hurts, stop. Don't do it. If you try it again later and it hurts again, maybe that's not the right exercise for you. And if you're wanting to know if it's something wrong with your body, then go and see your local physiotherapist or osteopath or exercise physiologist and get a personalized exercise program specific to your body and your needs. These are very general. So again, general rule of thumb, if it hurts, we're going to stop it. If it continues to hurt, maybe it's not the right exercise and maybe we need to find something new for you. All right, this next one, this is another challenge. I like challenging Loz. So we're going to go just a slight angle there. That's fantastic. This is just so you can see on the camera. I'm going to come around here. This is a windscreen wiper. So we're going to start with a level 1. Level 1, our legs are both up at 90 degrees. So we've got this nice bend and we're literally going to be like the windscreen wipers on your car. We're going to rotate our legs side to side. I'm going to ask Loz to pop her hands out to her side so she's got a nice wide base of support. And we're working in a rotational direction here. So we're really working the obliques. We're getting a nice spinal twist. We are working some of the spinal muscles as well here in rotation. But we're doing a rotation because it's different to planking, it's different to side planking. We're now working those rotation-based muscles. Now, because Loz is a champion and she's quite strong, we can progress her to basically the straighter your legs, the harder the exercise. Okay, so Loz is now taking these in a reasonably straight leg position. You can work anything from 90-degree bend all the way to straight. So even a slight improvement or a slight lengthening of the leg is going to increase the challenge substantially. And the straighter the legs, the harder it is. Also, how far you go, we get you to have a rest there, Loz, your feet back on the ground. How far you go dictates how hard it is as well. So don't think you have to go all the way to the ground. Some people's spines just don't go that far. I know I don't get all the way to the ground, and many people don't, and that's okay. So just work within your capabilities and within the range of motion that your spine is able to do. If you start with just a very small rotation each way, that is absolutely okay. And over time, you'll probably find that range of motion may increase. Okay, so that's our windscreen wipers, and that's a lot of our outer core and inner core exercises. I want to say thank you to Loz. Thank you very much for joining us. We'll let you run away. And we're going to bring in one of our physiotherapists here, Ray. Yeah, can you grab Ray? That'd be fantastic. While we do that, let's go have a little bit of a chat more around postural settings and what we can do to help ourselves at home. So those are the exercises that will improve the strength and the control and the condition of our core or trunk muscles. Again, most of the muscles around the trunk region. And you can mix them up. I very much encourage people to try different exercises and to vary them often, because our bodies like variety. It likes a varied stimulus. And that way you won't get any, well, you'll try and reduce the likelihood of getting muscle imbalances. No matter how much we do to help ourselves, it's still hard work sitting up tall all day. It's just tiring, and it's hard work. We're not designed to be this static. And like I said a couple of weeks ago, whether you're sitting or whether you're standing, it's still what's called axial loading. So definitely getting up and moving is going to help you throughout the day and reduce that amount of long-term axial load. But it is hard to sit up and be in this position, and some people find it hard to keep their shoulders back. There's two factors in this, and we talked again a couple of weeks ago about lots of pec stretches. So we do our pec minor stretches, and we might get into a door frame or a column or a corner here and stretch through our chest or pec major muscle to reduce the tightness at the front, pulling us round. The other thing we can do is we can use what's called K-tape to help support our posture. So this is K-tape or kinesio tape. It's different to what we traditionally talk about with our sports tape, which is a rigid tape. There's lots of different types of tape, and this is an Elastoplast sport kinesiology tape. It has got a stretch in it, so it's great at allowing to maintain your mobility and your movement while still offering you some support. It's also a really fantastic postural reminder, because what it's going to do, and I'm going to do this demonstration of this procedure for you so you can take your partner at home if you like, give it a shot. And we're going to help do this taping procedure to bring our shoulders back and down to remind us that that's the position we're in, so that when we start to slouch, it pulls us back a little bit. So what we'll do now is we'll bring in Ray, one of our physiotherapists here. Ray, if you don't mind coming and jumping on the chair there. Yeah, so if you don't mind, we're going to pop Ray's shirt off. He's agreed to all of this. And we're able to sit facing that way there, so hopefully we can all see. Yeah, that's fantastic. So what I'll get you to do, just spin around this way a little bit, Ray. Great. So we're going to do a taping procedure. In fact, I'll show the camera first. Sitting up really, really tall, where we're going to pull back in a X direction here from the tip of the shoulder down to a line about underneath our opposite shoulder blade. So the shoulder blade or the scapula, it's a triangle-shaped bone, and the point of it is about here. Our tip of the shoulder, you will sort of feel along and you'll feel some soft muscle. And then as you continue on, you'll get onto bone. That's where we want to start our tape. We want to go from the bone that's on the tip of the shoulder there, and we want to bring it down in a 45-degree or an opposing angle to just in line with the opposite shoulder blade. So I've already pre-cut a couple of strips of K-tape here. I'll just bring it up to the camera so you can see. And these are probably about, for Ray's size, this is about 30 centimeters in length. We're going to put a gentle stretch on it. Just pops that one there. Now, when you're doing this with K-tape, make sure to start with that we tear the backing. We try not to touch the glue on K-tape. It's a polyacrylic glue, and if we touch it with the oils of our fingers, it can actually break down some of the glue. So we peel that piece off of the backing of the tape to expose that end. Again, soft tissue, hard tissue, And that's where I put that exposed end of the tape. If I just get you to rotate around a little bit, Ray, we can see that there, that it's right on the midline of his body, and it's on the hard tip of the shoulder. Now, if I spin him back, what I do, and I'll come around this side to make it easier for you to see, is I fold the tape back and I start peeling off the backing. So I'm only holding on to the paper here, the paper backing, and leaving that exposed tape alone. And I gently apply, in this case, I'm doing probably about 25 to 30% stretch. So gently apply a stretch and pulling it across in that opposite direction, continuing to peel the tape back as we go so that we finish off with a little bit of tape left on the end that has no stretch on it, and we lay that down. And as you can see, that's in line with around about the bottom of the opposite shoulder blade. So again, we had no tension at the top, about a 25, in this case, about a 25 to 30% stretch through the tape to the last few centimeters, and then no stretch. You don't want stretching at the end of each tape, each end of the tape, sorry, because then it's likely to come off. Okay, so we have no stretch at this end, no stretch at this end, and in this case, about 25 to 30% stretch. The harder I pull the tape, the more it's going to pull him back. So if I pull it really strong, it's really going to extend him a little bit too strongly and too much, and I might risk irritating his skin or just making him generally uncomfortable. Okay, we're going to do the other side now. So I'll get Ray to spin around just a little bit more. Again, soft tissue onto hard tissue. And then we're going to peel that back, bringing down, crossing over in the middle of his back. Again, that 25 to 30% stretch, no stretch on the end. And what we should see there, hopefully you can see on the screen, is this nice, even cross. We give it a bit of a rub to warm the tape up so the glue reacts and it lasts for a few days. We can leave this K-tape on for up to 5 days. It can last for that long. If, of course, like any taping procedure, if, of course, the skin gets irritated, so if you find your skin getting itchy, getting burning, getting sore, take the tape off. You know, some people still will react. It's a very small number with K-tape, but some people will still react to the glue in the tape. And if that's the case, we take the tape off. This K-tape you can leave on in the shower. It can get wet. We try not to get it wet in the first 30 minutes of application, but after that it can get wet. And as I say, you can leave it on for several days. And when you do go to take it off, you just gently and slowly peel it back off. There are instructions on the box as well, and there's actually some taping directions in each of the boxes. If you head to Elastoplast social media and to the YouTube channel, you'll find a lot of taping procedures. And I've got a message for you at the end of this session about what's coming up next week with Tristan around some more K-tape procedures. Okay, so we have 2 more exercises to go. How are we doing on time? We're okay so far? So I'll get Ray to pop his shirt on again because he's going to show us our next 2 exercises. So again, that's a taping procedure you can do with your partner. You can do on somebody at home. It's a little difficult to do to yourself, but you could give it a try. You could apply the tape here, maybe kind of reach through. Depends on how flexible and how much of a contortionist you are, but certainly doing it to your friend, partner, housemate at home is advisable. And again, if there's any irritation from the tape, please just take it off. Give yourself a good wash and don't repeat the taping procedure if you're one of those unfortunate few people that are sensitive to the glue. Okay, our last 2 exercises. Bring out the big guns here. So for our last 2 exercises, we're going to get Ray into a full push-up position. Yes, we'll get your head up that end if you don't mind, Ray, and feet down this end. So these are advanced core exercises, these 2. These ones are definitely going to challenge you a little bit further than normal. This one's called a shoulder tap. So we're going to get Ray, move this ball out of the way. Excuse me. We're going to get Ray to separate his feet, and we're going to get him to bring his hands a little bit closer in this case to each other. Sorry, Ray, hands a little bit closer to each other. There we go. So he's in this beautiful straight line from his ankles to his shoulders. His eyes are looking down at his thumbs, and then he's going to tap the opposite shoulder. Step back so you can see. So we're going to take one hand and tap the opposite shoulder. We'll keep those eyes down so we can have a nice neutral spine, and we're trying to reduce the amount of rotation. Sometimes I'm a little bit nasty with Ray, and I come along and I put a foam roller there to make sure that he's not rotating too much and he can keep that foam roller. Yes, we do have a few games here. All right, so that's our shoulder taps. Ray, you can have a rest on your knees for a second. Again, this one is a more challenging core exercise. It's a progression of the ones we did earlier, and it's definitely going to take you to a total core workout because it involves the shoulders, the upper back, the abdominal region, the side trunk, the pelvis, the hips. So it is a really total body core exercise. So we'll now go to a full push-up position as normal. This one's called up-downs. This is another challenging exercise. Ray just loves this. So up-downs is we go from a high plank to a low plank. So we're going to go down onto our elbows and forearms, one arm at a time. So now we're in our low plank. That's our down. We go back to our high plank. Now up. Now we'll just get ready to do another 97 of these. You don't mind, do you, Ray? No. Ray could do these all night. He teaches a bunch of classes every week on our platform, and he does these things for breakfast. All right, thank you, Ray. No, that's fantastic. That's a really great demonstration. So thank you again, Ray, and thanks for being our model for taping. Okay, now Loz is going to feed me some questions. That concludes our section on exercises. We've got hopefully some chat questions coming through, and I'll see what I can do to help answer those.
Do you recommend core exercises for those who are more elderly? How do you adjust?
Great question. Do I recommend core exercises for those who are more elderly, and how would we adjust them? That is a really good question. One of the things with doing planks is you don't have to be on the ground. You could do it in the all fours position on hands and knees, but I know myself, I get a bit of a sore knee at times, and being in that position can be quite challenging. So I can demonstrate one for you here. Let's pretend that this stool is a kitchen bench or the back of a cat, something very safe to lean against. I could go into a high plank just on this. So again, if this was, and I'll bring it up so it's even higher, this makes it much easier. I can do my high plank here, or if it was the edge of a bed, I could do my low plank here. It decreases the load and the challenge to the core whilst being quite safe because we're not having to get down onto the ground. So that's one way, and I don't categorize whether that should be for older adults, but basically for anybody who's looking in for an easier version of that that's more suitable to their level, you can do it on any height. You could even do it up against the wall. You could be doing a high plank up against the wall, like a push-up position against the wall, and that's still going to get your core slightly engaged.
Planking exercises, would you recommend a small posterior pelvic?
During planking exercises, would I recommend a small amount of posterior pelvic tilt? So posterior pelvic tilt is when we tuck our pelvis under somewhat. I like to keep my the patients that I work with in a neutral position. So the hard thing about this question is it really does come down to the person. And I know as an audience member, that's the answer you hate hearing because it's hard to generalize what should be an anterior pelvic tilt or a posterior pelvic tilt. As an osteopath and exercise scientist, I can look at somebody's back and assess them and tell them that they might need more of a posterior or an anterior tilt, but I can't give that general advice to everybody that everybody should have more of this or more of that. What I do say generally is play around with a posterior pelvic tilt and an anterior pelvic tilt until you find a position somewhere between the two that feels comfortable. And that's more than likely your neutral spine or your neutral pelvis. So we go into a posterior pelvic tilt as if we're rolling our pelvis back, an anterior pelvic tilt as if we're sitting right on those sit bones, and then find a position somewhere between the two that is your neutral spine, and that'll be the best position for you.
When do you suggest you start body weight and core exercises?
When do you start body weight and core exercises? Yesterday is the best day to start. Look, there is no perfect start time. Any time is great. Any time in your life, you can improve your strength and conditioning. Anytime. So I've given these exercises or similar exercises with those abbreviated elevations, for example, to patients in their late 80s and seeing improvements in them. And there's studies that show this. that no matter where we are in our stage of life, we can always improve our strength and conditioning. But no matter where we are in our stage of life also, we need to be mindful of our capabilities and work to challenge them. But like I said before, within what you're capable of doing. So what is challenging but achievable? In that case, any day is a good day to start.
You think you're a youth?
If you're a young person, so for young people doing bodyweight exercises, no problem. Yeah, we do get some limitations with adolescents and young people doing loaded exercises with weights because we're still developing skeletally. But in terms of body weight, for these exercises particularly, they're very safe at any age. If you watch young children play, they'll do things far more challenging than this.
Do you recommend doing core exercises?
Weighted core exercise as well is a great segue into that. There is no end to the progression of these exercises. I used to work with some gymnasts from Cirque du Soleil, and you can only imagine the challenging levels that we got to work their core muscles. So weighting or loading core exercises is just another way to overload or to make them more challenging. We can do single limb. We can do inversions. We can put us into unstable platforms with foam rollers, with Swiss balls, with BOSUs, with all sorts of things. So yes, we often do weight our core exercises, and it's just one mechanism to overload or to increase the challenge.
Is it taking more for proprioceptive feedback than limiting?
So great question. Is taping more for proprioceptive feedback or limiting movement? Where some of the guys have already presented workshops and episodes here, episodes 2, 3, and 4, we're on different taping procedures, and they will have spoken about the different types of tape. And we've actually got one coming up, I think, 2 or 3 episodes from now, which talks about the different types of tape. So rigid tape is very structural in nature. We use that for structural purposes, and it's fantastic at limiting ranges of motion that we want to limit, especially in injury positions. K-tape, being that stretchy tape or kinesio tape, this one here, gives us the proprioceptive and kinesthetic feedback, so that information back to our body as to where it is in space, but still allows for mobility. So it gives us some support, fantastic proprioception and kinesthetic feedback, but still good mobility. Very different to our rigid sports tape.
Last one, would you recommend either all or a combination of these exercises or on alternate days?
Great question. Would I recommend a combination of these exercises daily or on alternate days? I'll go back to my point of body loves variety. It really does. A lot of the work I do as an exercise scientist with my athletes, both nationally and internationally, is around identifying muscle imbalances that they have that limit their performance. So we look at how they function, and we look at the imbalances in them that they have that are limiting their performance. And that's the same for the general population as it is for my Olympic level athletes. We want to reduce the imbalances that doing the same exercise all the time can create. So again, the body loves variety. So I would encourage you to definitely add a variety of these exercises, mix it up. Whether that should be every day or every second day, it depends on what you're training for. There's no problem doing these exercises every day. But when you're getting started, if you haven't done many core exercises before, you might start off with every second day, because you're going to be a little bit sore in these muscles. And then as you get more and more conditioned, you could bring in those alternate days as well. So you end up doing them almost every day. The one thing I would say to you though is listen to your body. If it's feeling sore, that's not the time to really train hard, okay? Listen to it, be kind to it, keep challenging it. Yeah, keep challenging it. Keep always looking to progress and improve, but also know when you need to take a rest day. Okay, so that's the bulk of the questions. I think time-wise, we are bang on 7:15. Again, I would really like to say thank you to Loz and Ray for helping out as our models tonight. I'd like to say thank you to you guys for joining us on this wet and wintry night in Melbourne. I hope where you are, it's nice and warm. Next week on Tuesday, we have Tristan Shire from the Adelaide 36ers doing a whole session on K-tape. So he's going to do K-tape procedures on the ankle, on the calf, on the shoulder, on the patella. You're going to learn a great series of K-tape procedures from Tristan. And he has been doing these for a long time, and he's very, very highly specialized in these. He's going to do a really great job teaching you these. So that's next Tuesday night with us on this series for the 6th episode for our Elastoplast Taping and Movement series. Thank you again for joining us, and I hope to see you soon. Stay well.